forward. Occiput on atlas. OA. I write that in my notes oftentimes. Okay? That's kind of osteopathic stuff, but they don't own it. Whatever. Okay? We write it all the time. OA, AA. Okay? What you're going to do is you're going to stabilize the posterior arch. I say posterior arch because C1, I guess if you look at some anatomy, it says transverse process. It's not, I don't know, it's really not a transverse process. It's not very big. It's tiny. So you're going to stabilize the posterior arch of C1 with your thumb on the side that you're standing on. You're going to push in more. And don't let C1 rotate. Does that make sense? Because when she turns her head, which way is C1 coming? This way. Right? Left rotation, C1 rotates left. I'm not going to let it go. Can you see how that produces a massive stretch occiput on atlas? Because I'm not letting it turn. If I properly stabilize C1 and don't let it turn, is she going to have very much head movement? Exactly. You're not going to see a lot of rotation. So if I come around and I see people doing this, yep, got it. Yep, got it. You didn't stabilize. You didn't stabilize C1. Okay? Now, this is not pleasant.
I'm good.
Okay? But hasn't that been the theme for today? Why? Because we're getting deeper. We're getting to the joint level, right? So, stabilize here. You're just off the spine. You're not midline. Some of y'all are going to be way out here, living way out to the side. Go right off of, if you feel the spinous processes, go right off of it. Okay? And you can't be too low to get C1. You got to be kind of right off the occiput. Okay? Right there. Okay? Get them in a little headlock. Okay? And I tell my patients, I said, look, I'm going to get you in a little headlock. You okay with that? I said, don't worry, I'm not going to jerk your head. Okay? I don't do this on the first visit. Okay? You got to build some trust and some confidence in what you're doing and your skills. Okay? They'll let you. Okay? They'll let you do almost anything. Ladies, with men, you can put a pillow here if you want. That's fine. But what you don't want to do is, whether you have a pillow or not, what you don't want to do is when you don't want to pull them into you. I see that mistake a lot. Okay? You want to keep them in relatively neutral and if anything, slightly forward knob. Okay? The female therapists that work with me that I've taught this, they just get right in there. They don't care. They don't care. That's their deal, right? Do what you want, okay? But they get after it, okay? All right, here it is. And this is exactly how I deliver the technique in the clinic, okay? She's making a face. And I'll back off. I'll do it again. Back off. Okay? And then when I'm done, I oftentimes will hit them up with a little bit of this. Okay? And sometimes I will do both sides. That guy that I was talking about yesterday in Pittsburgh, who was kind of translated and had all kinds of stuff, I did one side. Because one side was really restricted and prominent, and he was like rotated. It was I would have liked to, I helped him a lot that day. I would have liked to have like one more session with him, okay? And I said to him, you need to find somebody that can do this. He goes, I don't know who. And I said, well, what about the group of guys that you were just with right here? Aren't they PTs? At least do that, right? Okay, so here's the other side. So, I'm fine if you're fine. Whatever. Just got a job to do right there. There it is. Feel that? She feels it.
Show me where you're blocking it at.
Can you move her hair? Yeah.
So remember, I'm on the side. $100 for this.
Yeah.
Okay. I block just off
Gotcha.
the side, right below the occiput.
And then you're just trying to rotate.
And I turn her head and I push P to A with my thumb, and don't let, because if I just do this, here comes C1, I'm going with it. Don't let it go. Okay, and there will not, you're building the forces